right, greetings everyone, and welcome to Bright Spots in Healthcare. I'm Eric Glazer, and this episode is produced by Bright Spots Ventures. This is a special episode, a special Monday episode, unusual for us, but we've got a special topic and a couple of special guests. If you have not met us yet, Bright Spots Ventures is dedicated to accelerating innovation through content, communities, and meaningful connections. Our mission is simple: to spotlight what's working in the industry and help scale it. That's what we're going to do during this episode. We bring leaders together from plans, hospitals, and other healthcare organizations across the land to share proven strategies to drive measurable impact. Through this podcast, our executive councils, our private events, our go-to-market strategy work, we surface and amplify the bright spots in healthcare, these proven innovations that you can learn from and hopefully replicate at your organization. At our core, we exist to foster these trusted relationships that fuel real progress in our industry, because we believe the best way to improve healthcare is to find what's working and to clone it. If you have not yet subscribed to Bright Spots in Healthcare, I encourage you to do so. You could do it through YouTube. It's all free, by the way, or any podcast app that you use to get new episodes downloaded to your device whenever, every week. So welcome you to do that. There's so much great content that comes from the experts, like the ones that are going to address today's topic, the next frontier in self-funded benefits. We're going to talk about how Providence Health Plan's new partnership with Collective Health is a smart strategy to position them for the future. You know, the history of business is full of companies that sort of refuse to stay in their lane. You know, Apple didn't stop at computers, it reinvented the phone. Amazon certainly didn't settle on books. It redefined how the world shops. And each time that success came, not from protecting the status quo, right, but from seeing like where the market was headed and being able to reinvent themselves. Healthcare really gets credit for this kind of reinvention, but Providence Health Plan is attempting a similar kind of reinvention. At the same time, the One Big Beautiful Bill movement is sort of reshaping how employers think about the healthcare spend, how health plans are getting sort of their spending on the government side shrunk a lot. And there's this driving pressure to shrink overall costs. Providence Health Plan is leaning forward into the commercial space through innovation, and they're testing this approach with a new self-funded employer into the new self-funded employer market with some innovations with our partner Collective Health, who's a leading TPA in the country. So it's still early. Nothing's proven yet, but the move itself is a signal to the industry and to an innovative plan like Providence that they're rethinking how benefits are being delivered, integrated, and certainly measured in a more competitive, changing market. And that makes this episode worth studying. I think there's going to be a lot of fun things to talk about today. Our guests are the president and CEO of Providence Health Plan, Don Antonucci, and the CEO and co-founder of Collective Health, Ali Diab. So both of you, thanks for doing this. We were going to just do a regular recording. We decided to get spontaneous and do it live on a Monday. So excited you were able to make that quick turnaround and be here. Don, I'm going to start with you. Oh, and incidentally, folks, PSA, if you want to ask our guests questions throughout today's discussion, we may have a little bit of time to do that. Obviously use the Q&A module, not the chat. Use the Q&A module, not the chat. Makes it easier for our production team to manage all that. And we're looking for your feedback in about 45 minutes. Look for another email from me, and we'll be asking for your feedback about today's episode. All right, Don, let's get going. How is Providence Health Plan approaching retention and growth in 2025 and beyond? Like, let's start high level. What was the overall focus and strategy here?
Yeah, thanks, Eric. Thanks for having me on here. So for Providence Health Plan, first of all, we're what I would, call or use the term as a provider-aligned plan. You'll hear lots of different terms out there: payvider, provider-sponsored. I kind of call us provider-aligned, and here's why. We are part of Providence, which is a very large delivery system that operates in 7 states. That's headquartered in Renton, Washington. The health plan, a separate regulated entity, Providence Health Plan, headquartered in Oregon, and we're about 490,000 members. And importantly, in Oregon, we're in every single line of business. So whether it's self-funded, which we'll talk, I know, a lot about today, but importantly, we have, operations for Medicaid, with Providence. We have them with Medicare Advantage, individual, small group, large group, fully insured. And that's important as a provider aligned plan. Also, my background is about 30 years in the industry in different aspects of it, but I've been 4 years now with Providence. And it's eye-opening because I was mostly on the payer side. And yeah, I guess what I would say is what's eye-opening about it is you get to see, especially at a time like this firsthand, the challenges that providers are facing, but also the opportunities that are there. So one of the early things I learned really quickly was in the past when I thought health plans and providers maybe were talking the same language on a topic, I realized they're talking very different languages. So in my 4 years here, I've learned a lot more about what the delivery system side is focused on, the doctors, nurses, how that works, as well as what a health plan and is focused on. And that, kind of coming together and starting to get more aligned is actually a real benefit if you can be provider aligned. 30% of our utilization today is through Providence. That's important too. 70% of our utilization is outside of Providence. So that means Providence Health Plan has partners that include Providence, but aren't exclusive to Providence. We also work with other key delivery systems in the marketplace. And as it relates to your first question, the focus for us has really been about segment by segment as we focus on retention. It's making sure, first and foremost, in this climate, that we're getting to a place of financial strength. We're a health plan, like other health plans of payers across the nation are experiencing right now what many are. And if you take an example, Medicare is a good starting point, Medicare Advantage. The utilization, as you've seen across the nation, has really taken off, gone through the roof. There's a lot of post-COVID, happening there in terms of procedures and utilization, and then also pharmacy. And so as we focus on segments like that, it's a very different strategy than, say, self-funded. So for Medicare Advantage, it's all about how do we make sure that we focus on getting good quality star ratings? How do we focus on making sure that we're doing accurate risk adjustment, which is important, because that's what you have to be able to do with providers that are provider aligned to make sure that going forward, and this is really looking to 26 and beyond, that we're financially viable. So it's really segment by segment. The other stat I would share with you, and this is really kind of looking through the lens of the entire healthcare spectrum, but mostly from the provider side, which is important. Today in Oregon, Medicaid pays 53 cents on the dollar for every dollar of care. Medicare pays 80 cents on the dollar for every dollar of care. Employers, whether they're fully insured or self-funded, have always paid more than $1 for every dollar of care. That is being exacerbated even further. And there's much more of that you've heard before the employer shift. That's increased even more significantly. So that kind of ties a little bit in. I mentioned we're in Oregon. We also have a little bit of presence in Orange County, California, and Medicare Advantage. We also are growing into Washington State as well. So that's where the health plan's focused. But part of the reason we're focused on this partnership is really around providing really innovative benefits through collective health. And we'll talk more about that for self-funded employers. And we're looking to position ourselves a little bit differently. And that's why this is a really unique partnership, in that we're really provider aligned, looking to find out what's the most affordable, accessible, high quality care that we can provide in this arrangement with a leading platform that's, not only navigation services and technology, but, customer service as well, in a way that really aligns with providers, but importantly provides employers with better, more affordable options for their employees and their families. And for us, it's about leveraging the scale and partnership of collective health, which serves well over 500,000 members across the country. So I'll stop there, but that's where I would start.
Yeah, I want to get into the decision to decide to partner in a moment. Before Ollie, hang in there. We're going to bring in a second. But I actually had a question that I wanted to ask unprompted here, or sort of impromptu, I should say. So in my experience interviewing executives across the industry, I would say successful plans tend to have this. There's two different ways to get to sort of excellence as a health plan. You could focus your priorities and your resource allocation at the consumer, or you could focus your resources and your focus on the provider. Either way, you're going to get to a great provider and consumer experience. Hopefully, either way, you're going to get to excellence. So just think there's different paths to get there. And it sounds like provider aligned, right? So you are focused on the provider. Can you speak just a little bit to how that provider aligned strategy trickles down to a great consumer experience? Because you've had great success in the government markets where you get graded and compensated for that experience. And of course, I think that'll probably play into the commercial market too. So just a quick on that.
Yeah, thank you. And so what I would say is there's been a lot of talk, especially on the health plan side for many years about, providing a great consumer experience. And what I would say is we're not even, we haven't even scratched the surface. We're not even there yet. I don't think there's just maybe at times, but there's not a great consumer experience out there. And I think part of what can unlock that is two things. One's the provider side, which I'll talk about in a second. And two is technology and making it much more easier for folks to navigate. And, as it relates to collective health, some of their navigation experience is part of that. But the reason the provider experience, I talk a lot of in healthcare, there's major pillars that we got to focus on: access, affordability, quality, and experience. And I always say, yes, member experience is important. But as you would, I'm sure, agree with Eric, and I know Ali would as well, how do you what's the best way to get a best member experience? Sure, there's room for apps and, easier navigation, all that. But at the end of the day, it's about, are you having a good experience with your doctors and nurses? And what's the best way for a health plan or a third-party administrator to do that? It's to be provider aligned. And what does that mean? That means making sure that we're focused and aware of what are the struggles, what are the opportunities, what are the hassles maybe that a provider deals with day in and day out? Because I can tell you, having heard it and listening to stories, I'm sure we're guilty of this as well, but if something happens on the payer side, it doesn't make it easier for you to get the care that you need from a doctor. And sometimes it can be related to care. Sometimes it can be related to where you got to go get your next service. Then if you're not getting a good experience with the doctors and nurses you serve, then it absolutely translates into, I'm not getting what I need. I'm not having a great experience with my health insurance, my payer, because at the end of the day, if you're in the public and you're just not getting what you need or getting the care that you want. And so for us, a real advantage is aligning with those providers. Now, this is going to sound simple and I'm happy to expand on it, but it's things like, how do we set prior auth in place? We do a lot less prior authorization because we don't need to as a provider-sponsored plan. There's a lot talked about nationally about that. So how do we agree with our providers about these are the areas where this makes sense, and these are the areas where there isn't a need for prior authorization? How do we listen? This morning was on a call with a provider that was not Providence, and a couple small, seemingly minor things came up that were sort of inefficiencies from their perspective in directions that we're going in as Providence Health Plan. I've already done the background and research on those things and found out they're actually not quite accurate, as we looked at those. So we'll be able to go back and have that conversation there and talk about, well, that's actually not what's, happening or about to happen. So a lot of this is just dialogue, which we have the privilege and the opportunity on a daily basis at Providence to do, but it's also with those outside. They understand we're part of a larger system and they understand that we listen more, but you got to listen intently and then act on it and, start to reduce those friction points or, reduce some of the misnomers maybe that are out there. So that's what I mean by provider aligned. And, that's a big part of what we're focused on.
Hey, Eric, can I jump in? Sorry to interrupt.
Hold on, Ali. I want to introduce you, but I want to just summarize what I heard there, and then I'll have you jump right in, Ali. So first, we've got what I heard you say, Don, is we're losing money on government. We've got only 30% of utilization at Providence, 70% outside of Providence. Your quote was, we haven't scratched the surface on the consumer experience. And we're going to lock it with providers and tech, right? We were teeing up, Ali. This was all about teeing up, Ali. And the advantage to align with providers was like how it allows you to set up when PA is appropriate, when it's not, and then make sure that we're listening so you can reduce those friction points. I know I summarized a lot there, but I just want to make sure everyone listening and is taking notes could get that all. I am going to want to ask you how you decided to bring in Collective versus build it yourself. But Ali, I want you to jump in right now. Ali Diab is the CEO and co-founder of Collective Health. and who we've been sort of talking about, but not talking about. So come on in. What do you have to add?
I was just going to say, I think the choice between being provider focused versus customer focused, in my opinion, is a false choice. I think that if you really truly want to be customer focused and make your experience as engaging as possible, you have to be both. I mean, if you think about what makes great platforms like Amazon or Apple or Google what they provide an experience for people who are trying to sell you something, the provider equivalent in their world. It could be an app developer. It could be somebody making stuff that wants to merchandise it to you. And they also package that in a Chrome or a user experience, if you will, for the end user who's consuming it, that is very easy to navigate and to understand. But without the supply side being able to do what they do, think about the tools, for example, that Apple provides in iOS for people who want to develop games or apps. I mean, they're very, very robust. And it's what allows that consumer experience to be as excellent as it is, because those people providing things, supplying things in their case, have tools that make doing that really, really powerful and effective. And I think in healthcare, unfortunately, we have a bunch of intermediaries that sit between the people who actually do the care, provide the care, people like in Don's organization at Providence, and then the people who are effectively paying for and using the care, which outside of the federal context of Medicare, Medicaid, are large employers and the people on those plans. And so our job, I think, regardless of what your role is in my opinion, to totally reduce the cruft that sits in the middle of those two entities and provide really effective engagement and tools, powerful tools for both sides of that market. Because at the end of the day, it's really just a marketplace like any other, to engage effectively and to have a feedback loop with one another like you do with the internet or with platforms like Apple's, to understand me as a user, how to use something really easily and intuitively, and then me as a supplier, how to make that experience for that customer as engaging and as powerful as possible.
Can I jump in with just a very quick story to highlight this, Eric? So I was at the doctor about a year ago for just an annual checkup, and I wanted to go in and kind of look at my lab work again, kind of working on the high cholesterol and all of that as well. And in the past, they had, kind of done all of that there. And so two things. My primary care doctor, as I caught up with him, shared with me, one, from an experience standpoint, he had kind of asked what I did for a living and all that. I'm like, I work at Providence Health Plan. He's like, what do you do there? I'm the CEO. So we had a little chuckle about that. And then he said, hey, do you mind if I, kind of just record the first part of this? And I asked him more about that. It was the ambient technology that pulls into the electronic health record. So first 8 to 10 minutes, I can look you in the eye. But more importantly, what that did for him is it took 45 minutes to an hour off his workload at night. And this is a guy that hadn't taken a vacation in a long time. So anyways, I go and I say, hey, I'm here. And he's like, anything in particular? I said, I want to get my lab work done again. Well, the lab had changed in terms of it wasn't there anymore. I had to go through a separate appointment to go get that. So I was coming in thinking I was going to be able to get my lab work done and then get results the next day. Now I had to make a separate appointment. If you had asked me, was I satisfied with my doctor and all of that as well? This is kind of to Ollie's point. I'd say he's fantastic. But did I get the experience that I wanted? No, I came in there with a real specific goal in mind that was not achieved. What's interesting about this is, and I'm not trying to equate, you'll hear this in a second, a flat tire and going to Les Schwab, which is an amazing car service here in the Pacific Northwest with a doctor's appointment. But I had a tire as I was going to that appointment that for 3 weeks, it just had gotten low. And I'm like, all right, this is now a time for me to go in and let me pop, over to Les Schwab before I head back to work. I literally popped into Les Schwab, came in, they said, all right, well, we got your information. We'll take a look at it. Go sit down over there. It may take up to 45 minutes, but there's Wi-Fi, there's some food, drinks, you can go ahead. So I was able to do some work. Literally 25 minutes later, they called me back up. And this is the same day, by the way, as that doctor's appointment after the fact. And they said, here's your bill. It's $0. We found out where this was. We're able to repair the leak for free. You're good to go. Here's the printout. And, thanks, thank you so much for, coming into Les Schwab. So like that same day, wow, not even expecting necessarily to have to go there, do that, but everything was taken care of. And again, I'm not saying healthcare, it's obviously much more complicated, but the service I got there, that's what we should be striving for in healthcare.
And Les Schwab is not a paid sponsor of today's episode, but all right. So, Ali, I want to come back to you because you've spent so much time outside of healthcare, and I would love to sort of get a sense of sort of you had alluded to some other industries, and you mentioned Amazon, but what are some when we're thinking about the consumer experience specifically, and why it's so broken? What can we learn from other industries on how to fix it? Because Don already alluded to that we haven't scratched the surface. What can we learn from other industries?
I mean, I'll follow on what I said earlier, which is I think what we can learn, in my opinion, having worked in marketplace businesses, whether it's consumer internet or advertising on the internet, principally before healthcare, is that making things transparent for both sides of the market is really, really important to actually delivering excellent service. And I think if there's one thing that's missing in healthcare, from my perspective, is that things are still far too opaque, particularly for the buyer of healthcare. I don't know what anything costs in the US healthcare market before I've consumed it. That is unlike every other industry in our country. And I get that delivering healthcare is complicated. I get that things come up, but that's not different in the hospitality industry. That's not different in the travel industry. That's not even different really in complex retail or construction or other industries where there are a lot of change orders and a lot of change that occurs in the consumption of the service or the product. But I think, again, really powerful intermediaries over the course of decades have entrenched themselves in the middle, basically in between the buyer and the seller of healthcare, largely to enrich themselves, in my opinion, and have done so by creating a black box so that neither the supplier, the provider of healthcare, the physician, the nurse, the facility, nor the buyer, the employer outside of federal healthcare, or the individual understands what anything costs or why. And then they've instrumented a whole bunch of hurdles and hoops for both sides to be able to do anything. I mean, just think about, to Don's point, take your credit card company, how easy it is to understand your spending, or how easy it is to challenge a charge that looks...
How do we fix that? How do you think about fixing that?
I think you fix it through, as Don and I are attempting to do with our partnership, by removing that cruft in the middle and bringing the providers of care as close and as transparently as possible to the buyers of care, and then using technology and user experience design where appropriate. Technology, again, is not a be-all and end-all in and of itself. It's just an enabler at the end of the day, so that the people buying healthcare can understand what their options are, can understand why things cost what they do, so that the people on their health plans, if they have an issue, can question that issue really, really easily, not have to jump through 50 different hoops for a prior authorization or to submit an appeal as to why they got charged something that just seems outrageous. Those things all need to go away. And I do think at some level, even outside of the context of Medicare, Medicaid, the federal government does have a role to play. And I think regulators have been totally asleep at the wheel, in my opinion. I think the president in his first term did a bunch of good stuff by putting price transparency rules in place. But the penalties and the enforcement of those rules are paltry. Like, they don't really matter. And so everyone just neglects them. So you don't actually know the price of anything in this country still, in spite of extensive regulatory reform. And I'll give you just one example and I'll stop. In the US, if I carry a US health insurance card and I walk into a facility, in the vast majority of cases, because of the contracts between insurance networks and facilities, I cannot know what the cash price is for that service that I'm using my insurance for.
Yeah.
And if you don't know what the cash price is for something, you have nothing to base your negotiation on. And so to me, just simple things like just making it possible for Americans, foreigners can ask that question, but Americans can't, to understand what's the cash price for this and why is my insurance company getting charged 5, 10, whatever X times the cash price. Just being able to ask that question easily, in my opinion, starts to remove some of these sort of obstructions or hurdles in our way to having a functioning market.
Yeah, I like where you're going there, and I want to really focus on solutions to the problems, because I think we're all aware of some of the big macro problems pushing down on us. So, Dawn, let's get in. We've been alluding to this partnership. How did Providence Health Plan determine to build by our partner here to enable you to provide this enhanced consumer experience and move forward to what Ali is dreaming of as far as like price transparency and just a little bit more of a, I'm going to call it more natural marketplace here in healthcare. And then the follow-up to that will be, how does the partnership fit into your overall growth strategy, especially with the one big beautiful bill kind of and the policy shifts that we're seeing today?
Yeah, I think so. What I would say is the reason we chose this partnership was, really comes down to there was value alignment. That was number one important. You're hearing that today from Ali and some of the things that he's talking about. But the big reason was we're in a unique position as a provider aligned plan where we're not just focused on being a payer. We're actually focused on if these providers aren't successful, then we're not going to be successful as an organization. So what this enables us to do is not have to invest. I think, Ali, you've invested like $700 million into your platform. We don't have $700 million to invest in a brand new platform that's going to be best in class navigation. And importantly, as a provider aligned plan, the other thing I'm excited about is you hear a lot from providers and employers more and more about the desire to, what does it look like to do quote unquote direct to employer? So you'll hear like, whether it's a Providence or another provider say, what if we were able to actually take our network and just go all in or mostly in with an employer in a certain specific region? This allows us to be able to do that much more easily with the platform that Ali and team have built. So we can now work with those providers at Providence and Swedish and that we have in the family and those that we're aligned with elsewhere. And if there is a certain unique configuration they want to do, we're actually not looking to make money as a payer in this space. Most payers, if like us, regional plans, you're in a self-funded world. These are where employers are paying their own claims. So there's a small administrative fee that we really look to keep very efficient. We can take that transparent model that Ali's talking about and plug in those situations and really put the provider organizations first in that situation. And that will help us scale and grow into the markets that we're going into. So we've got a fairly big presence in Oregon from a self-funded platform standpoint. We have an opportunity where we've started to grow into Washington State, and this will really catapult that. But this was really about how do we partner with somebody that's value aligned fast and then not have to make the significant investments because we can't, the Ali team and the specialties that they have, and really create something that's unique. And Ali could talk about this too, versus what maybe they've done with other payers in the marketplace.
Ali, I want to get into sort of the success of the partnership and what you think that looks like, but I also want to look into the future too. I want to get there. So, but before we do that, I just want to do a quick little PSA for everyone listening or watching live. We typically, as I said at the beginning of the episode, we do Thursday shows. Almost every Thursday, we have a show at 12 p.m. East Coast, 9 a.m. in Don's neck of the woods. We have two shows, and if you'd like us to register you for free, we're going to do that for you right now. Thursday, October 2nd. I can't believe I'm saying October, but it's coming up. We're going to be talking about star savings and satisfaction and how to unlock specialty care strategies. Again, that provider network strategy for Medicare Advantage success. Great panel set up for that episode. Come on in and join us. And on October 9th, we're going to talk again about the GLP-1 integration playbook. We're going to cover PA. And we're going to talk about smarter plan design to drive consumer engagement and outcomes. So October 2nd, stars and MA with specialty care, and October 9th, GLP-1s and plan design and member engagement. If you want to go to either or both, we'll register for you. We'll put up a poll right now. So Ali, two-part question for you. What does a dramatically improved consumer experience look like in 18 months? And then as you see this partnership, what does success look like? And Don, I'll probably bring you into that second part.
Eric, with all due respect, I don't think we need to wait 18 months. We already deliver, in my opinion, a substantially better user experience than the health insurance industry does. Just look at something as simple as our net promoter score, which is in the mid 70s, is almost 10 times the health insurance industry average. I think we can build on that, obviously, but I think at the end of the day, we have a mantra internally, which is we need to make it effortless. And that's a very, very high bar, as you know, for people to understand, navigate, and pay for healthcare. That's really, at the end of the day, what we're attempting to do. Just like it's relatively effortless to understand, navigate, and buy something on Amazon, or understand, navigate, and download an app on the App Store on your iPhone.
Is that sort of in the collective health product roadmap, if you will?
Yes.
Because I guess what I'm thinking, I know you guys do a much better job than the vast majority of the industry as far as consumer experience, but what does my consumer experience, if I move to the Northwest, Pacific Northwest, what does that look like in 18 months when you say need to make it effortless?
Well, it looks like things being written, as basic as things being written at a third grade reading level.
Yeah.
The vast majority of people don't understand the terminology of health insurance, let alone healthcare. So if you simplify things for people, just like you do in retail, they can make better decisions. If I spent most of my time trying to communicate to you the amount of silicon or gallium arsenide on a chip versus just telling you how many songs you can download, that's a very different conversation, even at a sort of retail level. But we all understand how many songs you can install and then what memory sort of means because of that. I think healthcare is no different. I think people love to hide behind the fact that healthcare is complex and complicated. I call BS on that. I don't think healthcare is any more complicated than any other industry if you actually take the time to simplify it and explain it to people. Moreover, I think people are so interested in their health. To Don's point about, whatever it is, tracking his cholesterol or whatever it is, that they will actually, in my opinion, and we've seen it even with our own users, seek to understand something that may be beyond their reading comprehension in a way that may not be the case in other industries. So to close on your question, I think we already provide an exceptional level of service. And with Don's team and the coordination with a provider-aligned health plan, I think we'll bring the providers in and allow them to engage in a way that they haven't been able to engage, so that you can do things like look at your health record within the context of your health plan, be able to understand why a certain lab is being requested and how much it would cost before you go and get that lab. Those are just examples, but ultimately make it like any other market where I understand why my providers ask me to do something. I understand what the financial implications are, and I can question or look for alternatives if I feel like it's unreasonable. That's really, at the end of the day, what we're trying to do with our platform. Not unlike an Amazon, not unlike an Apple.
And Don, I'll let you jump in here now too, but Ollie, you could jump on back on the top of this. What does the partnership look like if it's successful? What outcomes in year one would you need to achieve to make that partnership a success?
Yeah, it's pretty, simple, cut and dry for me. We're doing this to not only retain our current base, but to grow our membership. And, what that looks like is pretty significant growth, not only in Oregon, but in Washington State over the next couple of years. And I believe that's an outcome of just doing the right thing, where we're not only going to improve the provider experience and the member experience, but, a key part of obviously the employer market that Ali, I know, could talk about even further is the other thing that we really loved was Collective Health does an amazing job with the HR benefits administration to make things very simple as you bring accounts on or renew accounts and reduce a lot of the bureaucracy and the need for expertise that's sometimes there because of how they're set up. The other thing that they do a great job with is getting engagement. There's so many point solutions and point solution fatigue out there with employers. Ali and team not only vet those solutions along with us and others, but they actually get people to engage at much higher rates and get to use them. So I think what I'm looking forward to is that growth is really the outcome, but also hearing from all those providers, employers, brokers are really excited about this. The producers in the market that really are the ones putting these options in front of employers, hearing back from them, the excitement right now, but it'll be really exciting a year, 2 years from now to hear, wow, this really made a difference for this employer and for their employees. So that's what I'm looking forward to.
What about you, Allie?
I mean, I think the thing that excites me is that, again, I'm going to use these analogies just because that's the world that I come from. If you think about what Amazon or the App Store represent, they represent, in my opinion, two things, first and foremost. They represent choice. There are millions of things you can buy on Amazon to suit everyone's taste and need. Similarly, there are millions of apps you can download on the App Store to satisfy anyone's taste and need. But they present that information in a way that reflects a deep understanding of who you are individually, right? It's not like you go to Amazon.com or you go to the App Store and they give you like a vomitorium of 800,000 apps and just go scroll through. That's not how it works. They kind of understand who you are based on your history, based on things that you've installed, based on what you do, and they suggest things to you. They merchandise, but out of a massive repository of products and apps. And then obviously when you search for something, they do a fantastic job matching your intent or your interest with what's available. And I think that also is something, in my opinion, that is lacking somewhat in healthcare, if not to say a lot. I think we need to do a much better job merchandising and understanding the customer so that we can merchandise what's appropriate to them, and then also matching them with the most appropriate care, whether it's financially, whether it's clinically, whether it's both, ideally. And to me, that's what I'm excited about. I'm excited to be able to bring a lot of the power that Don and his team are able to harness on the provider side of things as a provider-aligned plan, and then merchandise that really, really effectively to the people on our health plans and the employers that are basically paying for most of it.
And Eric, one thing I just add would say that the secret sauce, which shouldn't be a secret for Providence Health Plan and why we've been so successful now, and what I think this partnership is going to make us successful, is we're very mission focused as an organization, and a lot of that obviously is with Providence in partnership with them and focusing on some of those vulnerable populations. But we have a promise at Providence and at Providence Health Plan that we share, which when I heard it, I was like, that is so powerful, and it's really aligned with collective health. And the promise that we talk about, it's called Know Me, Care For Me, Ease My Way. But when you really think about that, who doesn't want to be known in health? So we're looking for ways as Providence Health Plan of how do we know our members, how do we know our providers better than anybody else? And we do that through the listening, we do that through the data that we collect. How do we care for people, not just with the quality care that they receive, but as Ali mentioned, how do we care for them by providing more transparent data, getting them engaged with certain services? How do we pick up the phones? What's the technology we put in front of them? And then ease the way. I mean, who doesn't want a simpler, more connected, healthcare experience? And I just looked this up again, Ali, correct me if I'm wrong, but, collective health mission is to transform the way people experience health benefits by making the entire process from understanding and navigating to paying for care clear, simple, and accessible for both employers and their employees. That's Know Me, Care For Me, Ease My Way in a nutshell. And I think the key is always just bringing ourselves back and starting there versus focusing on some of the objectives maybe that others have. That's our number one objective at Providence Health Plan.
And I don't think that that's unique to healthcare. I think every great company does that in their industry.
So how do you guys, so the one thing that I think may be a bit different from the Amazon metaphor is, at least in some cases, is you not only need to engage them and provide them a good experience, but then we need to ensure that they follow up, right? And that consumer stays engaged with that line of service, which so many health plans and ACOs and are struggle with, especially on the government side, but even commercial side, but certainly on the government side. How are you guys planning? Like, what's the plan there? How do we keep folks, once they're in, we get them on the hook to stay participatory in their care?
I mean, I can offer an answer. I mean, at the end of the day, it really comes down to making sure that your engagement with that patient or that consumer is relevant. I mean, I'll give you my own example and experience, which is what led me to start the company. As you know, I was hospitalized 12 plus years ago with a small intestinal obstruction. Spent a lot of time in the hospital. I had some really painful, surgeries that I had to go through. Almost, didn't make it as a result of that experience. Was discharged, thankfully, and recovered. But I remember getting calls from my insurance company months after I'd been discharged, asking questions that were totally irrelevant to my care. Like, had I been to the general surgery clinic and had my wound examined, like 2.5 months after I was discharged. And then what was really interesting is you'd think a large payer with millions of interactions a year with patients would understand that there are associated complications with that kind of a surgery, including behavioral complications, and would reach out and offer to help with that context in a way that was value adding. I mean, as you can imagine, after an event like that, I had a lot of post-operative dysphoria and phobias. I did not want to leave my house. I didn't know like what my health was going to be like, and I needed actually a lot of behavioral health care support. I got no offer of support, frankly, from the provider system that took wonderful care of me and, ensured that I lived to see another day, but absolutely not from the insurance company either, which you would think, with all of the data that they have and the connections they can make from those data, would say, hey, we know that people who go through something like this also typically need behavioral health support. Do you know that your plan covers A, B, or C in that realm? Instead, I was effectively forced to go search for psychiatrists and therapists and others who had experience in this domain. And I ended up spending a ton of time, wasting a ton of time and money. Whereas I feel like that's something that you should be able to do. And one of the core tenets of our navigation experience at Collective Health is that we connect those dots for people and we provide relevant, value-adding suggestions and interventions versus just check the box stuff.
Weird call out. Let me ask a follow-up from one of our listeners right now. So on the provider side, one of the challenges is there's several major payers have good technology for access and information, but the providers that have multiple technologies to access across a patient base. So has this issue arisen in your experience? And Ali, I'll let you go first, then Don, if you could jump in.
I mean, I will say we don't operate in the provider space per se, although we do interact with providers, day in and day out as part of the service that we provide with supporting members through their health benefits. So whether it's, helping with prior authorizations or appeals or what have you, I do think there is merit to that statement. I do think providers are in multiple systems. I am, though, I think to Don's point about sort of ambient technologies and other technologies, quite hopeful that there is a consolidation that is occurring in that respect on a lot of large platforms. I think Judy Faulkner and her team at Epic have built the ultimate platform in that respect and will likely integrate a lot of these capabilities. But if you think about what Epic does, it does consolidate a lot of those workflows into one place, whether it's note-taking, prescription fulfillment, referrals, billing, coding, etc. So I think provided that we can, no pun intended, we can actually hook into those kind of systems through a provider-aligned health plan like Providence, I think then we can provide additional context to members that historically has been kind of abstracted away from them, because there usually isn't that kind of integration in a health plan setting. Usually you kind of live in My Health Online or the equivalent when you're a patient and dealing with your system, but you don't ever really interact with that capability, even though I think you actually should have access to it within your health insurance experience. I think the exceptions are maybe plans like Kaiser, where they have brought coverage and care kind of together into one app, so you can understand the financial and the clinical kind of together versus them being artificially divorced like they have been historically in pretty much every other payer provider context. And so I'm excited that Dawn and I can bring those worlds together in care and coverage, much like in an integrated delivery system like a Kaiser, can kind of be co-resident and live together in one user experience. So I don't have to jump between things to understand stuff.
Don, does that work for you? Or do you have another answer to add on to that?
Well, I just know that, again, I'm not on the provider side specifically, but I hear a lot about what Providence is focused on and then other provider partners. So there is a lot of different data systems and integration. The good news is that it seems to be consolidating, as Ali talked about. And I do think that's the opportunity for us to, what I don't think we've done really well yet, and I would agree that Kaiser's probably done that pretty well just based on their model, is making sure that we're taking advantage of all that data and integrating it together on behalf of members in the whole notion of whole person health. So I think we're going to continue to see a lot of developments there, but I know that Providence is very focused on the doctor, and nurse experience and using technology to support that and make it easier. And a lot of that is around that consolidation and those prompts that Ollie talked about.
Is there a model, guys, that you guys that exists somewhere in healthcare, outside of healthcare, that you're using to advance this partnership objective? Is there that you could share? Like, is there sort of a template outside of the industry that Ollie had, or something, or is this more of is this a traditional sort of plan TPA kind of collaborative? Like, what's the model that's going to advance this?
I can start, and then Ollie, you jump in. You may have a totally different opinion. I think the real power of this, and Ollie and I have worked together before, both at different organizations when I was in California in a different way. But I think what I'm most excited about this as it relates to the self-funded business is we're bringing perspectives and mapping things together that really haven't been done in this model before with a provider aligned plan. So I think, obviously Ollie and team bring just an amazing background experience with technology and navigation and customer service and that flexible model that they have. What I think we bring now is a real understanding of what providers are going through, the network configurations that may be really powerful and appealing to employers. And I think most importantly, our focus, like I said, back on that promise of our ultimate focus is how do we best know, care for, and ease the way in the communities that we serve today? And how do we do that extremely well? That's literally the objective. And that's actually pretty freeing. I think enables something that's very unique here versus maybe what others do with their various models. So we're breaking down silos through this model in ways that haven't been done before. I've even had brokers kind of say, what's the catch? I mean, you guys must be getting something for this, and this seems too easy. And we're like, no, this is actually the point, is we're looking to actually make this very simple and easy and get you connected with, the providers to serve your employees and their family members. Ollie?
Yeah, I mean, again, I largely draw on my historical experience outside of healthcare to think about what good looks like from a user experience. That being said, I do think there are some models, both in the US and outside the US, that we can learn from and draw from. Again, I think Kaiser is actually quite effective within the confines of Kaiser. And so if I think about a model for the future, I think about a model that is kind of as simple and integrated as Kaiser, but with a lot more choice.
Ollie, I get the Kaiser one, and I think a lot of us listening probably know a bit about it with a lot more choice. You just alluded to some globally. I don't know if there was a specific one you had in mind you wanted to share.
Yeah, I think there are national health services in parts of the world that have done this well as well. I think of places like Singapore. I think of places like Israel. I think of places like Japan, where they have very sort of user-friendly, largely electronic front doors to schedule and access care, and then a very transparent mechanism to understand what you owe and what you don't owe, and a method for you to be able to pay your portion if there is a portion, and to understand what's been deducted from your wage bill or what have you. Like, the data is there. What's really standing in the way isn't necessarily technology per se. It's a willingness to want to expose that data and to share it. And I think in the US, unfortunately, I think payers don't have any incentive to do that, even when they own the asset. I mean, not to call on anybody, but I will. I mean, United Health Group owns 1 out of 5 primary care providers in the country. Even with those primary care clinics, is it easier to schedule when you're on a United Health Care plan? It's not. Why is it not? And so even when you own the asset, why is it not something that you make easier for people to use and to access? That's the question I think we should all be asking.
Don, coming back to you and just looking at this landscape that you're facing in 2026, where's your focus? It's a question from one of our audience members.
Yeah, the focus around the self-funded side with employers is really around getting this model in place. We've got 9/1 effective dates that have come on already, and our biggest, obviously, renewal season is 1/1, and then really starting to, make sure that we've got all the right processes and connection and all that Ollie and my teams are working on together. So making sure that's effective. As it relates to just business in general, it's really segment by segment. You mentioned the one big beautiful bill. So there's a lot going on. This is more Oregon statewide and not necessarily Providence specific about how do we make sure that Medicaid is sustainable going forward with some of the new costs and coverage criteria and all of that. So that's, we get involved statewide there. Medicare Advantage is, like I said, much more about, all right, how do we make sure that we're maintaining our, star ratings and focusing on star ratings, making sure that we're doing accurate risk adjustment and really focusing on the populations best we can in the communities that we serve. So that's what that's about, along with some federal advocacy and things that I do through places like, AHIP, America's Health Insurance Plans, or the Alliance for Community Health Plans. There's a whole bunch I could talk about there. And then, individual, small group, we all know that the enhanced premium tax credits is a big deal going on. So we're watching that closely. And so it really is segment by segment to understand how do we best serve, how do we get more and more tight with all of our providers, including Providence, and then make sure that I look at 2026 as a year, for not only payers, but also providers. It's kind of a year where we've got to kind of get reset from a financial standpoint, make sure that we're at least as a health plan break even as an organization, and then go from there in 27 and beyond and really expand these models. So it's I'm excited about it. We've been doing a lot of hard work on the major categories that we can affect as a health plan, and that includes obviously administrative efficiencies, but there's things called managed care savings, where we're making sure that there's the right type of utilization and appropriate care that's happening at the right place at the right price. So there's quite a bit going on there for us. And then just making sure that we're pricing ourselves competitively to make sure that we earn and retain business, but also that we are financially, strong as we go forward as a health plan. And so that's the big focus areas for me in 26.
So I know we only have a few minutes left. I would love to have both of your takes on the learning so far that you want to share through the partnership. I know it's relatively early, but just to mention, some groups are onboarded already. And, how should payers be thinking about the client, the employer group, and the customer experience over the next, year or two as we're moving into the future? And what are some of the things that you've learned from just forging this partnership this year?
I'll just say two things and then turn it to Ollie. So I think with a few minutes left, I started out my career doing research in health plans. So there's a place for quantitative metrics. Ollie mentioned things like Net Promoter Score and things like that. But there's also, importantly, a place for qualitative metrics as well. So making sure that we're listening, hearing from people, asking the questions. So I think part of what I'm making sure I'm instilling with my team is that we're looking at both things and asking the questions and following those up to make sure that this is really effective. I think the one learning, and this may be unique for Providence Health Plan, is that we're a 41-year-old health plan. Providence is 170 years old as an organization. We take a lot of pride in what we do. So there was a big cultural shift here for us because we were doing this ourselves, and we were just recognized even with J.D. Power as the number one health plan in the Pacific Northwest. So we pride ourselves on customer service and what we do. We also kind of want to skate to where the puck's going, and we knew that what the demands were going to be and where things had to go with innovation and investment. So making this move was not simple and easy. Last thing I'll leave you with is one of the most important books I read in a few years was Start With Why by Simon Sinek. And he says, every organization knows what they do. Some know how they do it in a differentiated way, but very few know their why. So we know our why, but the key part of that book is start there. So we knew that to know, care for, and ease the way of our members, patients, providers, that this was going to be a real accelerator to that for us, but also a big shift from what we've done day in and day out over many years.
Maybe my favorite TED Talk of all time. And so,
yeah.
Yeah, I would second what Don said. I think from our perspective as a technology platform and service partner to organizations like Don's and to large payers and payviders and provider systems, there's a change management curve that we are very familiar with, that we have to just remind ourselves that, people have gotten accustomed to doing things a certain way for a very long time, and it takes a while to kind of rewire things. It's a little bit like why people lament at least to date, largely low ROI on AI investments. Well, it's not just enough to deploy a technology or a new way of working. You have to get people to get comfortable with that way of working and to abandon potentially older ways of working, so you're not duplicating work and duplicating cost and effort. And we recognize that, having partnered, and I mean, the essence of our company is to partner with large payers and payviders for the last decade plus. And sometimes when things, I mean, Don and I will complain to each other sometimes, like, why can't the teams move faster? Why can't we get to where we want to go quicker? That's just the nature of working with people. People are creatures of habit, and it takes a while to change their behavior. Even consumers, it takes a while to change their behavior. Not everyone went out and bought an iPhone when it came out in 2007, because not everyone was comfortable giving up a physical keyboard. I don't know many people now who want a physical keyboard on their phone almost 20 years later. So you just have to remind yourself that there's a change curve. And as long as you're making meaningful progress month over month, year over year toward your objective, you're doing okay. And if you're a payer, all I would say is the changes in Medicare, Medicaid reimbursement should be the canary in the coal mine for you, that this kind of change is also going to happen in the private part of the market. If you've been living high on the hog for decades without adding a tremendous amount of incremental value other than just simply contracting with providers, I think you should be very, very worried about what the future represents.
And I'm trying to, you got in my head now, is that the Everett Rogers kind of adoption curve? What are you referencing?
Yes. Well, there's many, but there's the traditional sort of S curve and technology. I mean, it's the classic crossing the chasm. Like, you have early adopters who are going to jump.
Chasm is where I read it. That's right. But it's the Everett, but he stole that from Everett Rogers, right? I believe.
I'm not sure, but Jeffrey Moore, at least in the tech sector, is the one that everyone references when they talk about that.
Sorry, all right. We only have a couple. I wanted to ask you a few more things, but why not just real quick? Where can listeners? Where should they go to learn more about this partnership? Where can they follow the model? All of that.
I think the best place is to reach out to me on LinkedIn. I got a wonderful team with any kind of questions or connection. We can get you to the right folks.
All right, perfect. Love it. Well, guys, thanks so much for doing this. For all of you listening, remember that survey now is in your inbox. Please take a couple minutes to complete it. Give us your feedback. We may even send you a little gift with some of the notes from today's show. So thank you. Guys, Ali, Don, great job. We started right today with the power of zigzagging, zigging when others zag, so to speak. And the companies that see change and see sort of the marketplace changing and lean into it tend to be some of the most successful ones. And Providence Health Plan, Collective Health are now kind of doing exactly that around self-funded benefits. And I think hopefully can succeed under this new era of healthcare. And just, it's early, but like, Apple, Amazon showed us, sometimes the boldest move is the one that's contrarian. So not that it's contrarian per se, but I think it's a bold move. So great job. Look forward to hearing more about it. Thank you, everyone who's been listening and watching, for spending the time with us. We do not take the hour you spend with us for granted. We hope that you use the ideas shared by Don and Ali in this conversation to inspire your thinking and your company's overall approach to improving healthcare for all of us. Take care, everyone. And remember, this is your Bright Spots in Healthcare podcast.